We are committed to building the evidence base in integrative oncology. Our research team works to bring evidence-informed, reliable information to patients and their families. We test the effectiveness of new therapies, natural health products, and how to ensure that each patient's treatment is optimized for their needs.
Our research agenda really is focused on two types of research. One is the conduct of specific randomized trials on promising natural therapies. And the other is on looking at the whole system of care that's provided within a setting like this that is integrative.
One of the things that we're both passionate about as organizations is research. Let's learn more. Let's find out how we can be even more powerful in the fight for cancer survivorship. Research here makes this center unique. The work that's being done here in a clinical trials type of environment is learning and is going to benefit the next person. So I think it makes OICC quite exceptional.
My brother and I do research together to evaluate if melatonin will prevent lung cancer recurrence in patients who've had resected lung cancer. First study of its kind in the world, multi-center, running in multiple centers across Canada. Melatonin has been shown to extend life in patients who don't have resectable disease, their advanced disease. And so we're evaluating if it can prevent lung cancer recurrence.
The evidence over the past years has increased tremendously, and that's not to say that all complementary therapies have been studied, but there is a lot more known than there used to be. And the safety profiles are also becoming much more well-defined than they were in the past. Based on the demand of patients, this research has grown quite a bit, and based also on the availability of a group of interdisciplinary researchers that have taken this on, I think we have really moved into a phase where there are options for cancer patients, and options that have been studied properly. Increasingly, people are using complementary therapies in addition to their conventional cancer treatments, and they experience benefits. And that's what we're seeing in our research, that's what we're hearing from cancer clinics, where there is an option for people to use some complementary therapies, that they are feeling more well, that they are dealing with their side effects.
I think working as a team between biomedical physicians and naturopathic physicians is an important step forward, both for the province of Ontario and also for Canada as a whole. So I think this will provide a focus and also a laboratory, if you like, a test bed for a program that in future hopefully will expand across the whole of the province and the whole of Canada. One also hopes, and I'm pretty confident that this will be the case, that the patients will actually have more effective conventional treatments. They will stick with their conventional treatments because they will have less adverse effects. They will be empowered to have choices to actually deal with those adverse effects.
The Ottawa Integrative Cancer Centre is a cool thing because it's finally pulling it all together. You have conventional providers, you have complementary providers working together in creating a care plan for patients that's going to comprehensively meet their needs. Our research program, Cameo, is addressing the education and information needs, but we're not able to provide care. And the Ottawa Integrative Care Centre is pulling it all together, doing education, providing the care, empowering the patients. And it also has a research lens, which is so important because it will be evaluating the impact of that care, and it provides us evidence to encourage other settings to create similar models of care.